My name is Terry Pahacek. I am a professor of health management and policy at the School of Public Health at Georgia State University. I am pleased to discuss our latest research on tobacco regulatory science, which is published in the journal Tobacco Control. We explored the concept of lost pleasure as associated with smoking cessation. This is an important issue that has been at the heart of debates over how to regulate cigarettes in the United States. As background, smoking rates for youth and adults in the U.S. are at all-time lows. However, cigarette smoking remains the leading cause of death and serious preventable disease in the U.S., including many ailments beyond lung cancer and heart disease that fall under the umbrella of chronic obstructive pulmonary disease, known as COPD, diabetes mellitus, and colorectal and stomach cancer. Public health advocates continue to seek federal regulations to assist their efforts to encourage smokers to quit and to prevent young people from taking up the habit. Here in the U.S., the Food and Drug Administration, also known as the FDA, is required to perform an economic cost-benefit analysis of proposed regulations. That includes proposed regulations that would involve advertising designed to encourage smokers to kick the habit and to make smoking unattractive to youth. In recent years, the FDA has included a measure of the lost pleasure of smoking in its analysis of proposals to require visually graphic warning labels on cigarette packs. These types of images have become the norm in scores of other countries, but have not been adopted in the U.S. Some researchers have questioned whether smokers truly enjoy the habit and whether a focus on lost pleasure overstates the economic burden on smokers of regulations designed to encourage them to quit. Our research supports the argument that federal regulators should give more weight to the fact that a high proportion of smokers are unhappy about feeling addicted to cigarettes and should put less emphasis on the current theory that smokers who quit are losing pleasure in their lives. Our Tobacco Center of Regulatory Science at the Georgia State TCOR analyzed data from more than 1,000 adult smokers in the United States. We found that more than 80% expressed discontent about their inability to quit, felt they were addicted to cigarettes, and regretted that they ever started smoking. When we asked smokers in the study to offer the first thought that came to mind when they heard the word cigarette, their responses included cancer, addictive, nasty, stinky, expensive, dangerous, and stupid. Very few talked about feelings of pleasure. Our study used data from the 2015 Tobacco Products and Risk Perception Survey conducted by Georgia State's TCOR. Our research team found that levels of discontent among smokers did not vary by sex, age, race, ethnicity, education, or income. This study found that most smokers feel deep regret about their habit. Smokers said that if they could do things over again, they never would have started smoking. Additionally, many frequently spend time worrying about their risk of developing lung cancer and other serious diseases. These people are not continuing to smoke because they derive pleasure from their habit. As smokers themselves stated it, they are addicted and wish they could quit. These findings are important because they point to a different measurement that should be used in the cost-benefit analysis employed for assessing proposed regulations on smoking. In summary, this study supports the argument that regulators in the U.S. should set aside the lost pleasure measurement in favor of a new assessment of the potential reduction in discontent that smokers would enjoy if they quit smoking.